molecular diagnosis, pathology of enterotoxemia in sheep and goats, its control and prevention. As we all know, we are always in the fact that enterotoxemia denotes toxemia of intestine. In generalized toxemia, mostly whenever it is associated with the intestine, any damage or any toxin-like conditions or damage due to any toxins in the intestinal mucous membrane, we call it is a enterotoxemia. And here the enterotoxemia term mostly used frequently in case of genus Clostridia origin bacteria. Here what happens, Clostridium perfringens, that is your gram-positive anaerobic spore-forming bacteria, as you all know. Let me say something about 1 or 2 lines about the history of this organism. Earlier it was known as Bacterium welchi or Clostridium welchi. Then after, by the honor of name, your William Henry Welch, then after it has been named as perfringens. The literal meaning, especially in the Latin words, it is known as breaking. And that particular term, that is perfringen, it has been given by William Zuber. As we know, this is a normal component of decaying vegetation, marine sediments, as well as intestinal tract of man, animals, and also in the soil. Why we call it is in the soil? Why it is present in the soil? Because it is a part of fecal material. And fecal material they used to come outside and they remain inside the soil. But one thing, one grace from the God, that it remains a very few time in the soil. Its lifespan in the soil is very less. That may be the reason generally we don't get lots of infection, especially those grazing animals. As for its, it is already classified into A, B, C, D, E, F, G, depending upon its 6 major toxins. Other than that, few other minor toxins are also there, as I have mentioned here. B2, alpha, gamma, and collagenase and other things. You can see it here. As regard my next slide, the principal cause of the caprine enterotoxemia I am talking about in case of goat, that is caprine, is mostly we have seen that is due to Clostridium perfringens type D. Enterotoxemia in case of goat, mostly we have seen. It is a study. It is a study. In few literature, I have collected this information. I have collected it. Whereas type A mostly we get in case of enterotoxemia in sheep. And disease mostly, this particular disease enterotoxemia mostly occur in 3 or 4 forms. In some cases also there is 4, but mostly it is 3 forms. That is for acute, and chronic form. Principally I am talking about. In some cases we have seen in the subacute form are also there. As for the history, clinical signs, and gross postmortem, I am talking about the introduction, then only we will discuss something about in a precise way. Then history, clinical signs, and gross postmortem lesions, whatever things we are going to get at the time of postmortem, that may not be helpful for proper diagnosis. These are the diagnosis, or we can say that is a presumptive diagnosis. It is not possible to get a definite diagnosis. So, but here one thing we are going to get sudden and high mortality rates in case of kids and lambs. That is the real threat of this or devastating effect of this particular disease. Because there is no time, the disease is not going, that particular organism is not going to give you the time to think about even. Immediately there would be sudden death, and you cannot check that type of death if it is in case of lambs and kids. That is the real problem of this disease. That's why we are taking lots of serious steps, and we are taking lots of sincere efforts in these directions. So definitive diagnosis, we have to go for in the molecular way. We have to detect the toxins. It is economically important and devastating, as you know, because it is sudden death mostly we get in case of sheep and goat. Then in suckling lambs mostly we get, and mostly we call it is a case of milk colic. Milk colic. It is also known as milk colic. The ovine enterotoxemia was reported from different countries, including India. I have mentioned few names here, few countries here. All over the world, we are facing the heat of this problem. In case of caprine enterotoxemia, also same thing happens. As regard the ovine enterotoxemia as well as caprine toxemia, in both the cases throughout the world, we are facing this problem in a similar way. Enterotoxemia mostly in a particular study, I have collected one information regarding 31% and 21% prevalence in sheep and goats. So here from this data, I can assume that 31% means more we get in sheep in rather than in goats. And sheep case fatality, as far as fatality rate is concerned, that is 40%, 40% average, depending upon the total effect or morbidity. Then morbidity rate does not exceed 10%. But one thing is very sure, and we have to keep in our mind that herd, in a total herd, if morbidity may be 10%, out of 100, there may be 10% morbidity would be there. But almost we are going to lose almost all the infected animals or affected animals. That is the problem of these conditions. As regards the etiology, again, I am repeating few words. Then gram-positive variable straight rods, and this is one thing I would like to mention here: large and boxcar shape, large and boxcar shape, and sometimes it is soft-terminal spore. Generally, we get here, and it is although capsulated, non-motile, obviously. It bears soft-terminal bulging spores, as I have already discussed, anaerobic, atlas negative, and oxidase. It is a brief idea about the etiology of this particular organism. Then mostly it prefers to grow in enriched media. We will discuss in details about what are the enriched media we are going to deal with. Then colonies of surrounded by zone of double hemolysis. Okay, sir. So next, we would like to say something about the major toxins. In the introductory part, we have already discussed regarding the, it has been classified into A, B, C, D, E, F, Z, depending upon its major toxins. So here I have depicted in the tabular form for easy for our viewers. So regarding the disease problem here, I would like to mention here that is yellow lamb disease. It is due to toxinotype is A. Likewise, lamb dysentery, it is B. Then hemorrhagic enteritis, or in case of kid, we call it is a hemorrhagic enteritis, but in case of adult, we call it is a stroke. Like that, enterotoxaemia here, that is due to type B. So depending upon the pathogenic Clostridium perfringens, depending upon this pathology and the nature or cell or tissue they affect or infect, it has been grossly divided into three parts, that is neurotoxic, histotoxic, and enterotoxic. So as we all know about the Clostridium tetani and botulinum, they belongs to that category, that is neurotoxic. Mostly they damage the nervous, they release some toxins, they damage the nervous tissue, or they have got some nervous signs as well. Then same thing happens with the histotoxic, they damage the muscles and all these things. That's why it is named like that. Then enteropathogen, that our area of interest for today's presentation, that is Clostridium perfringens, A, B, C, D, and E, F, G, that is whole 6 type, depending upon their major toxins, and enteropathogenic enterotoxemia. So here I have mentioned few important facts or things about the virulence factors. Virulence means it is the power, or we can say that is a disease producing power of that particular organism. Here we are discussing something about the Clostridium perfringens. And what are the virulence factors? Number 1 is alpha, number 2 is beta. And here I have in the column number 2, I have mentioned what are the particular target cells or tissue mostly it damages. Okay. Alpha damages the phosphatidylcholine, then then sphingomyelin, then beta likewise intestinal epithelial cells, endothelial cells of the blood vessels, and secondary neurons. Then epsilon. Epsilon is the important toxins here. We are going in details about epsilon in later part of this presentation. Then endothelial, it damages the endothelial cells. Then mucosal tight junctions, it breach the junctions and it loosen the junctions of these two epithelial cells. They can enter into, then only they can enter into that particular blood vessels. Then they will go to the circulations. So lymphocytes, all the vital organs, including brain. Likewise, iototoxins here also, they are having some sorts of cell, they damage the cell cytoskeleton. Likewise, enterotoxins also, they are having some similar type of action as we have already discussed in case of epsilon. Few other toxins, that is NET-B, beta-2, and porphingolysins. These enterotoxins and porphingolysins, these porphingolysins overall we call it is a PFO, or it is otherwise also called as theta toxins. They are having some peculiar actions or very typical action as far as pathogenesis is concerned. So here they are basically, they are chromosome derived, and the rest of the toxins what we are discussing in this table, they all are plasmid derived. Okay, sir. So types of Clostridium perfringens diseases and their major toxins. Here I have mentioned few things about the diseases especially. So we are now going towards our topic of today's. Whatever things just now till now we were discussing about the that particular organism and its virulence factors or toxins, etc. But now we are directing towards the disease what we are going to discuss in this presentation. So type A, and mostly it is responsible for the necrotic enteritis, necrotizing enterocolitis, hemorrhagic gastroenteritis in other animals. Type A having alpha toxins, it is the major toxins here. Type B, here I am interested in today's presentation, that is lamb dysentery, hemorrhagic enteritis in the calves and foals. Here we are going to discuss about the lamb dysentery, but their toxin is beta toxins as well as Clostridium perfringens type B. Then after type C, stroke we have already discussed, and hemorrhagic enteritis in case of in small kids as well as in lambs. And stroke mostly we get in the adult sheep. But here one thing is very sure, sudden death. In both the cases, in a lamb dysentery as well as in stroke, there is sudden death. This is the only problem with this type of organism or disease. Then comes your type D. This is very interesting. Enterotoxaemia, in two sense we call it by type D. Whenever we are discussing something about the enterotoxaemia, in case of sheep and goat, mostly the one thing it is coming to our mind, that is type D, and another conditions mostly it comes to our mind, that is pulpy kidney disease. Okay, but as a whole, enterotoxaemia is a generalized term. Not only in case, it is not due to only this particular organism, that is type D. It can be due to some other organism or different types of Clostridium perfringens. That's just I wanted to say in these presentations. So factors, what are the factors? These are the factors we also call it a predisposing factors. And these factors have got some special significance in this type of disease, in this particular type of disease, enterotoxaemia we are talking about here. So here let's discuss one after another. That is excessive consumption of milk, and ration is rich in carbohydrate as well as in protein. Natural immunity is compromised due to any reason. Maybe malnutrition, maybe due to any type of chronic diseases, maybe due to exercises, or strenuous exercises. These are the natural immunity would be compromised in this condition, so that whatever the bacteria, the normal bacteria which are present in the intestine flora or intestinal areas, and they will proliferate and they will start producing toxins and results in enterotoxaemia. Then animals are when there would be heavily parasitized. Other than that, few more factors are, and very important factors, they are also responsible in this disease process as a very important factors or predisposing factors I am talking about. That is presence of trypsin inhibitors in the colostrum. As we have already discussed, lambs and kids, they are mostly affected, and the sudden death mostly we get in these two groups, kids and lambs, because they used to get colostrum from their mothers. But colostrum having very little trypsin inhibitors condition, but trypsin may not be available there. So that may be the reason to growth and multiplication of this type B. And that particular lamb or that sheep or kid, they may suffer from lamb dysentery-like conditions. Low level of, because trypsin is very sensitive for trypsin. If the trypsin would be available in the colostrum, immediately it will destroy or neutralize the beta toxins. If trypsin is very less in colostrum, inhibiting factors are there, trypsin inhibition factors are there in the colostrum, definitely there is an upper hand would be taken by these beta toxins and results in lamb dysentery, enterotoxaemia. Then low level of pancreatic secretions. I am talking about pancreatic juice, low level, because this is young age. Obviously, young age, so pancreas capacity is very less to secrete maximum juice, pancreatic juice. Because as we all know, the pancreatic juice contains three major enzymes, that is your amylase for carbohydrate, then for lipase as well as protease enzymes. They are responsible for the digestions. If the juice is very less, and obviously there would be indigestion. As we all know, indigestion results in enterotoxemia. Yes, another factors. Then abrupt change in diet, we have already discussed. Then intestinal hypomobility, another factor, or we call it is overeating. Due to overeating, mostly we get this type of condition. Most of the cases we have seen the good body condition also results in enterotoxemia, and some other predisposing factors are also there, condition of the environment and humidity and all these things. So let's move to the next slide. Before going in details, disease-wise enterotoxemia or symptoms or signs, just I have made one slide. What are the common signs of enterotoxemia so that immediately we can diagnose this may be a case of enterotoxemia. It would be very helpful for our field veterinarians. Those are here at this moment of time. So this is a poor acute form. You are talking about poor acute. So there would be sudden death within 12 hours of clinical sign. First sign, clinical sign, within 12 hours, there would be death. Then kids or lambs, there would be central nervous signs, that is excitement, convulsions, like that. So in poor acute, I am talking about. Then typical clinical sign include loss of appetite, abdominal discomfort, then profuse watery diarrhea, then sudden onset of or depression. Then death usually occurs within hours of onset of signs, and sudden neurological signs, as we have already discussed just now. These are the few things I have mentioned, because before going in details about the different diseases, you will get this much of conditions or this much of common signs in each and every enterotoxemic condition, especially in sheep and goat. So as regard the pathogenesis and pathogenicity, pathogenesis is the process of or progress of the disease. But here, what is pathogenicity? Pathogenicity is the state or capacity or potential ability to produce that particular disease. This is the basic difference between pathogenesis and pathogenicity. And capacity, pathogenicity, it is a capacity to produce or the ability or the potential ability to produce that disease. That is pathogenicity of that particular microorganism. Let's discuss about certain virulence factors. Obviously, they are responsible for this pathogenesis and pathogenicity. We have already discussed about the in before slides in a tabular form. Then some other minor type of toxins we have already discussed. Some major toxins, alpha, beta, and epsilon, iota, enterotoxins, and net-B. These are the major toxins we have already discussed. Then as a range of minor toxins, that is hemolysins, collagenase, then porphyrolysins, then beta-2 toxins, hyaluronidase, like that. These are the minor toxins. I would like to say here, there are 23 numbers of particular toxin genes available in this Clostridium perfringens. They are present in the Clostridium perfringens depending upon their nature, depending upon their conditions. They will secrete one after another. Why? Because these are the toxins they use as a strategy to live in the body. Because they are also fighting. They are also struggling for their existence. That's why God has given this much of toxins to them. For their, suppose you will make the environment aerophilic. So obviously they will die because they are anaerobic bacteria. So obviously to resist or to exist in the aerophilic condition, or in oxygen tension, they have to develop such type of things in there, so they can exist in that, in spore form, in the spore formations, so that it can transmit in the soil or one host to another in the spore formation. So there would be no degradation of the spore. These are the few characteristics, and mostly they are dependent upon this is the characteristics. They are dependent purely on the toxins production by that particular bacteria. Moving to next slides, this is a very important slides I have collected from an article. So pathogenesis of epsilon toxins. Why I am talking about epsilon? As I told you that there are near about 30 different toxins are available with this particular organism, that is Clostridium perfringens. But epsilon is the most notorious one. And these epsilon toxins, they are, though it is plasmid derived toxins, they are not chromosomal derived toxins, but this is the most devastating toxins and most notorious toxins. And this is the main reason for enterotoxemia, what we are talking about today. So here excess carbohydrate we have already discussed in our predisposing factor. It gives the environment for the rapid proliferation of the Clostridium organism. Then there would be epsilon. Epsilon mostly they present in the prototoxin form. Prototoxins. And prototoxin, by the help of trypsin, it will be transformed to, it will be converted to or activated to epsilon major toxins, or it would be activated form of prototoxins, we can say. Then we will discuss about the this action of this particular epsilon toxins. In its role is pore formation and cleavage of tight junction. Yes, we have already discussed. It is responsible for the cleavage between the two epithelial tight junctions. Then only it will enter, as it has been depicted in this schematic diagram, and finally it enters the bloodstream or capillaries or any vein or any circulation. And then it goes to each and every vital organs for its devastating effects. Let us discuss one by another. The role of epsilon toxin in pathogenesis. This is very important aspect of this today presentations. Why we are discussing something about the epsilon toxins? As I told you, there are 30 toxins. They are derived from 23 types of toxin genes. But epsilon is one of the important toxins responsible for so many types of enterotoxemic conditions in sheep and goat. That's why I have decided that let's discuss something about epsilon and its pathogenesis or pathogenicity. Let's discuss. The question comes here, why kidney? If it is brain, then why brain? If it is intestine, why it is intestine? Why not other disease especially? Why you are not discussing about other organs? Why you are discussing about pulpy kidney disease? Why damage the kidney only? Why it damages the brains only or brain only? So these are the few things. I hope this particular slide will clear about all these facts. So mostly in kidneys, these ETX means epsilon binds to the distal tubules. Yes, there will be some changes will take place because some receptor, that particular receptor is present in that distal tubules, and starts degeneration of distal tubules, and there would be, obviously there would be hemorrhages in the medulla of that particular kidney. So as a whole, there would be damage to the kidney. In the brain, what happens? It binds the endothelial cells of the blood-brain barrier. So obviously there would be swelling, there would be necrosis of the vascular endothelial cells, and with rupture perivascular astrocyte processes. You should know the role of astrocytes in maintaining the balance between the blood-brain barrier and balance between the brain and that fluid, that cerebrospinal fluid. So that role of the astrocytes especially, it is so high and so crucial role it plays in terms of BBB, maintenance of the blood-brain barrier, as well as the barrier between the exchange of the fluid between the CSF as well as in between brain. So we are going to lose these astrocytes due to these particular toxins, because that astrocytes contains a very peculiar protein, or we can lipoprotein, we can say, as a receptor. Let me discuss. Then there would be leakage of fluid, protein, or hypoxia. Obviously there would be edema or degeneration of the white matter and astrocytes. White matter and astrocytes. There would be degeneration of white matter of the brain as well as astrocytes. The astrocytes, those are present in the white matters especially. Then diagnostic, mostly it is sheep. Mostly we get it very pathognomonic diagnostic in case of sheep enterotoxemia. But this type of condition we get very rarely in case of goats. Then brain responds to edema by upregulating the expression of the water channel protein, that is aquaporin 4. Here we say the one word I have mentioned in a different color, that is aquaporin 4. You know it maintains the water channel. In failure of the aquaporin 4, so obviously there would be entry of water and it makes or results in edema. So damaged neurons, astrocytes as well as oligodendroglial cells or oligodendrocytes, resulting in neuronal damage as well as there would be demyelinations. You see the conditions, but why this type of condition happens? So here let me discuss about myelin lymphocyte protein, a particular protein or lipoprotein, which is also known as MAL protein, which is mostly expressed on the endothelial cells. And whatever the cells just now we have discussed, endothelial cells of that blood vessels, the brain, oligodendrocytes, as well as in astrocytes, as well as also it is also present in the maturing lymphocytes and renal cells. The expression of this particular MAL protein or lipoprotein, like they act as a receptor. They act as a receptor for this particular epsilon toxins. Then we are going to get this type of conditions: damage to kidney, damage to brain. There is edema, there is necrosis. Only the receptor present, and this type of receptor we don't get in other organs. That's why level of damage or extent of damage is limited in other organs in comparison with these three organs. That is your intestine, kidney, as well as in brain particularly. So here what happens? Demyelinations. Then demyelination by inhibiting the potassium inert rectifier, as we all know that potassium ion will come out and excess amount of calcium ion would be enter into the neuronal cells. Then excitatory neurotransmitter also upregulated, and there would be chance of nervous sign. Why there is nervous sign? Because there would be upregulated of the excitatory neurotransmitter, that is a glutamate targeting the hippocampal glutamatergic system. Okay, so here one thing I would like to, this type particularly epsilon toxin, it activates the sphingomyelinase enzyme. They damage the sphingomyelinase enzyme, and ultimately what happens? Damage the cell membrane of the neurons. So obviously what will happen? Finally the balance, the ionic balance of the cell would be lost. The integrity of the membrane would be lost. So excess calcium will enter inside the neurons or inside the brain cells, maybe glial cells, maybe astrocytes. Then after, what will happen? Then after caspase independent apoptosis process would be there, because there would be presence of, there would be damage to the membrane of the mitochondria. The damage to the membrane of the mitochondria leads to caspase independent apoptosis. So these are the few conditions and associated with the epsilon toxins and results in this type of disease conditions. So as regards the clinical signs, in the last slides we have discussed about the common clinical signs in generally in enterotoxemia, but here I have made some specific disease and their clinical signs. Here sheep, Clostridium perfringens type A, mostly we see in case of sheep. That is acute enterotoxemia in lambs. Mostly we get depression, anemia, icterus, that is your jaundice, as well as hemoglobinuria. Yes. Then Clostridium perfringens type B and C, they are also responsible for this enterotoxemia or yellow lamb disease here. But sudden death and acute neurological condition, mostly we get it here, as well as hemorrhagic diarrhea. Then we'll discuss something about the lamb dysentery. Lamb dysentery and hemorrhagic enteritis occur in lamb under mostly 3 weeks of age, 3 to 10 weeks of age. Then stroke mostly we get in case of adult sheep. Morbidity in the flock up to 30%, but mortality it is so high. First week of life, mostly during the disease process, what we get? The abdominal distension, pain, and blood-stained fluid, or without premonitory signs. In postmortem, what we get? That is extensive hemorrhagic enteritis. In the postmortem lesions, mostly we get extensive hemorrhagic enteritis. And obviously, there would be fluid accumulation or edematous condition in peritoneum as well as in pericardial sac. Here, few photographs I have collected from different resources here. Here there is a depression, diarrhea. Here we can say lamb dysentery, blood-stained diarrhea. Then also you see here there is a depressions and some organs also. I have kept few photographs here in the liver as well as icterus in case of pericardial fat, as well as icterus, icteric conditions or jaundice-like condition or yellowish discoloration in the abdominal organs. As regard the let's discuss something about pulpy kidney disease, which is caused by Clostridium perfringens type D. That is, as far as the poracute form, it is young goats mostly we get here. The sudden loss of appetite, marked abdominal pain, kicking at belly, fever, and death. We all know about, more or less, we know about that. Then in case of acute, that is diarrhea, abdominal pain, same. There is no discrimination between the poracute and acute, more or less same. But shock condition, opisthotonous condition would be there. And most of the time there would be blindness also we have seen in some cases because damage to the eyes. So in subacute cases, as well as acute cases also we get blindness. So subacute cases, blindness, head pressing, bloating, and subtoning of the faces or diarrhea, we can say. And diarrhea, generally we get threads of intestinal mucosa. We will get it in case of diarrheic fluid. In chronic form, mostly, it is very, in chronic form, we don't get chronic form. Generally, they die immediately just after poracute or acute form. But in few cases, we may get chronic form. Still, there is diarrhea, profuse diarrhea, weakness, or weight loss, anemia, death. There may be a death, or some cases we may get recovery. So one thing, clinical pathological clinico-pathological aspects, one thing there would be a very interesting thing, that would be hyperglycemia and glycosuria. Hyperglycemia means the normal range of the blood glucose should be 25 to 60 or 65 like that milligram per DL, but here it would be more than that. So, but in case of glycosuria, there should not be any glucose in the urine, but here the range is so high. In acute disease, the postmortem case, in postmortem lesions, what we are going to get, that is hyperemic areas in the intestine and fluid accumulated in the pericardial sac. Here what happens in the, why we call it is a pulpy kidney disease, mostly we have seen that is a rapid kidney autolysis. Damage has been done by the epsilon toxins and later on it would be autolyzed immediately. Rapid autolysis results in pulpy kidney disease as we have seen. So another thing, just I would like to mention it here, there would be some problem with the brain and there would be encephalomalacia conditions. We have already discussed why brain is mostly affected in case of a toxin due to epsilon. Here few photographs I have kept it for the reference. Here we can say there is a depression, there is opisthotonous conditions, there is a blindness as well as pulpy kidney disease just below. And there is a huge enlargement of the liver, as a icterus liver, or we can say, and there is hemorrhagic intestine, severe degree of hemorrhages in the intestine. Then we'll discuss something about the stroke. Stroke, as we all we know, that is Clostridium perfringens type C is the causative agent here. Then sheep at pasture, most of the time it will die on the pasture itself. Immediately we will say morning it was good, but just after 1 hour, you will get the dead body on the pasture land. So this is very peculiar conditions. Animals may be found in the terminal convulsions. So before that, you may get, just before death, we may get convulsions. Mostly beta toxin plays the major role in this pathogenesis. And postmortem findings include ulcerations, intestinal ulceration. Mostly it is limited to, it is in and around jejunum. Then patchy hyperemia, some region there would be some hyperemia, accumulation of fluid in the peritoneal cavity, then congestion of peritoneal vessels and petechial hemorrhages are also there. Let's discuss something about the clinical pathology. What are the clinical pathological findings? We are going to get it here in case of enterotoxaemia. As we have already discussed, in the urinary glucose, strongly indicative of enterotoxaemia in sheep and goat in both the cases. And after death also, during life and death also, if you take the urine and you estimate it and you will test it, definitely there would be glycosuria. This is the magic we can say. And after death also, you can diagnose that it is glycosuria, though it is indicative of enterotoxaemia. Then hyperglycemia, yes, of course there. In goats, RBC and hemoglobin level is decreased significantly. Like that WBC level would be increased, as we have already discussed. This is a bacterial infection. So obviously WBC level would be high. So non-significant changes were also observed in case of PCV as well as in case of platelet. As regards the biochemical analysis, what we are going to get, that is the significant increase in liver enzymes, all the liver enzymes, maybe AST, ALT or GGT, whatever it may be, all the liver enzymes, because there will be damage to the liver due to this availability of the toxin in that particular organism. Then in case of creatinine, total bilirubin and blood urea and glucose also, there would be some changes. So in sheep, mostly leukocyte count and packed cell volume was significantly higher. Like that in serum biochemistry also, you will get some high degree of creatinine and all this and blood urea. As regard the postmortem lesions, what we are going to get? In case of sheep, mostly there would be generalized icterus. We have seen few photographs in the last slides. Enlarged and pale and friable liver. Enlarged and pale friable liver. Red tinged urine also we will get. Diffusal multifocal hemorrhagic enteritis or excess serosanguineous fluid would be in the available would be in the abdominal cavity. As regard the brain, this is very important aspect of this particular disease, that is enterotoxaemia, that is herniation of the cerebellum in foramen magnum. Few photographs I have kept it. I will show you. Then encephalomalacia. Encephalomalacia mostly we see in the chronic cases, and some hemorrhages in case of midbrain and cerebellar peduncles. Pulmonary edema also we see here, and pulpy kidney condition also we can get in case of sheep. In case of goat, as regard the postmortem lesions, procolor pericardial fluid, which is rich in protein, obviously, and mostly we get it in the for acute condition. In chronic case, we get fibrinohemorrhagic enterocolitis and pulmonary edema. In kidney, generally we see petechial and ecchymotic hemorrhages and other conditions what we have already discussed, like pulpy kidney disease. But pulpy kidney disease, we have to keep one thing very particularly. Pulpy kidney disease is not so significant in case of goat. As we have already discussed in case of sheep, yes, we are going to get it. Most of the cases we can get it. But goat, it is completely inconsistent. Not always we are going to get it. Next, we will discuss something about the histopathology. As we know, this is the molecular diagnosis and pathology of enterotoxaemia. That's why I have kept lots of slides on clinical pathology, histopathology, postmortem lesions and all. And later on, we will discuss something about the diagnosis, molecular diagnosis especially. Then type B and C, there would be coagulative necrosis. Yes, of course, that perivascular edema. If there will be edema, damage to the cells, damage to the blood vessels, obviously the membrane, that particular blood vessel membrane or that vessel wall would be permeable, highly permeable. So obviously fluid part will come out, the protein part will come out. That's why it would be proteinaceous edema condition mostly we get. Then brain, degeneration of white matter, we have already discussed. Then hemorrhages, and hemorrhages would be there, then damage to the astrocytes and the chronic form, necrosis of the white matter, grossly known as encephalomalacia. Encephalomalacia is a condition, necrotic condition of the brain, characterized by softening of that particular tissue or brain tissue. That is also called as encephalomalacia. But encephalitis is something different, that is inflammation. So perivascular edema also there. In case of intestine, what we are going to get, that is severe congestion, hemorrhages and necrosis. Yes, of course. Then kidney, as usual, we have discussed several times, that is pulpy kidney, postmortem changes due to rapid autolysis. Then meningeal congestion with perineural edema. Meningeal congestion and perineural edema in the cerebral cortex, in the brain, or intramural edema also we can get in the cerebellum. Few photographs I would like to say in the next slides, hopefully. So before going in details, what are the tests to diagnose this particular disease? What are the samples we need to collect? If there would be a condition, we are suspecting it may be a case of enterotoxaemia. This is very important slide. For the brain, you have to take it for histopathology, obviously 10% formalin, and that would be confirmation. If we are talking something about epsilon toxins or type D, so obviously brain will give you the maximum maximum information about its conditions, about its type D infection or enterotoxemia. Then colon, for histopathology, you have to collect it in the formalin. For the gram stain, air dried, room temperature, you have to keep it. For gram stain, we cannot use formalin as we all know it. Then small intestine content will be better. Then refrigerated or frozen, removed from the intestinal loop. Mostly we have to keep one loop. Then it should be refrigerated and frozen. Then only we can target the toxin. Which type of toxins? We have already discussed, that is CPA, CPB, and ETX, or some other toxins also we can target. And swab and intestinal content also can be taken for the PCR or other molecular techniques. Here just I have kept few photographs, whatever things we have already discussed in the histopathology, that is coagulative necrosis of intestine. Here we can see it. And then here we can glomerular necrosis. Here we can see that is the star shaped. I have made some star mark there. Then hemorrhagic enteritis. You see the massive hemorrhages in the lamina propria of the intestine. Hemorrhagic enteritis. So few more photographs I have kept it here. There is a photomicrograph of small intestine, mostly in a sieve, that is enteritis due to enterotoxemia. A and B, please see here. That is here necrosis of intestinal mucosa, then intestinal mucosa congestion, and inflammatory cell infiltration. In case of B, please you see the whole length or whole surface of the that particular villi is full of mononuclear infiltration, mononuclear cell infiltration. See it here. Likewise, here there is some photomicrograph of some vascular changes in the liver in right side of the. I have kept few photographs of liver on due to this enterotoxemia conditions. Some necrotic changes, some vascular changes, some changes in the cells, and some edematous changes also it has been mentioned or it has been shown. Intramural vascular edema in the brain, the first picture, I have kept it here. Second, you can see there is again there is a hemorrhages, massive hemorrhagic condition in the brain, mostly cerebellum area. Then we can see here there is number 3, left side number 3 picture, please see encephalomalacia conditions. We have already discussed in the last slides, encephalomalacia conditions. And one area I would like to mention it here, that is perivascular coughing. Just you see just in and around there is a huge accumulations or surrounding mononuclear cells or lymphocytes there. This is also called as a perivascular coughing. And here in the right side, we can see some changes in the morphological changes in the astrocytes of the white matters of the brain. Let's discuss something about the diagnosis of enterotoxemia. So tentative diagnosis, mostly it is done by clinical history or clinical sign. That may not be confirmation, but tentative diagnosis, you can go for it. For isolation or identification, we have to go for selective media, then biochemical characterization. And for supportive diagnosis, what we can go for? Then hematology, serum biochemistry, and urine examinations. We have already discussed what we are going to get. In case of urine examinations, in case of biochemistry, in case of hematology. We have already discussed in case of, in the slide of clinical pathology, findings of the clinical pathology. Then for pathological diagnosis, necropsy lesions, histopathology, and immunohistochemistry. For molecular techniques, detection of toxin genes particularly by PCR and qPCR. Serological tests are also very sensitive here, that is ELISA and MNT. MNT means mouth neutralization test. Let's discuss something about the diagnosis. Diagnosis is a very important part of this disease. That's field diagnosis, clinical history, sign, and necropsy. These are all presumptive diagnosis. But sudden death without any premonitory signs and hemorrhagic intestine, this is very characteristic lesions, we can say. Sudden death and hemorrhagic intestine. It may suspect, we may suspect this may be a case of enterotoxemia. But we have to go for the molecular diagnosis. We have to target the toxin. Otherwise, we cannot confirm this may be a case of enterotoxemia. postmortem examination must be performed on site. I'm talking about field diagnosis. Then we will switch over to the bacteriological and biochemical test. What are the biochemical tests or bacteriological tests we can go for? Then impression smear from the small and large intestine, we have to go for it. Then we will get that particular bacteria in the impression smear. Yes, of course. So Robertson cooked media, some few other media I have mentioned here, and mostly for double zone hemolysis, as we have also seen in the last slides. That is Clostridial supplemented Brucella blood agar. Mostly it is a very prominent double zone hemolysis pattern of colony. We will get it. Like that TSC egg yolk agar, that is also very characteristics. That is your opaque halos colony. We can get it. So here biochemical test. What are the biochemical tests we can go for? That is sugar fermentation test. It is positive. The indole, it is negative. Methyl red, negative. And VP, it is also negative, but litmus milk test, it would be positive. As well as nitrate reduction test, it would be positive. H2S production, it is anaerobic bacteria. Obviously, its character is production of gas. So obviously, it would be positive. Moving to the next slide. Here I have kept few photographs. That is your double zone hemolysis, in which media I have already discussed. CSBBA means Clostridial supplemented Brucella blood agar. Here also TSC egg yolk agar, that is pitch black colony as well as opaque halos. Here one thing I have kept another egg yolk agar. There is a growth. It has been divided into two important divisions. And one area we have antitoxin we have applied to half of the area, and without antitoxins. So where there would, it is a case. I am talking something about the third. Please look at the below slide, below picture, below photograph. I have kept it. That is, it is a very important. That is lecithinase activity, and anti-lecithinase antitoxin generally we employ here in this condition. And wherever there is a neutralization of the lecithinase, so there will be no changes. No changes. There will be no lysis. There will be no breakage, and there will be no whitish. Everything is normal. But in antitoxin we have applied in half of the slide. There would be no whitish discolorations or coagulations. But wherever there is no antitoxins, there is white discolorations due to activity of the lecithinase. Is the important enzyme we get in case of alpha toxin. So detection of toxin genes. And now we are going to discuss about the molecular diagnosis or molecular detection of toxin genes. Number one is PCR, polymerase chain reaction, a very useful alternative, obviously. Detection of epsilon toxins, it is important aspect. Then also multiplex PCR also we can go for it. And multiplex PCR is a high prevalence beta-2 gene also we can get it through this multiplex PCR. And real-time PCR also, that would be very helpful. Mostly, almost all toxin you can get it due to this real-time by the help of real-time PCR. And another thing I would like to mention it here, that is immunohistochemistry is also very significant in terms of diagnosis, especially toxin genes. And serological and biological neutralization test, mostly ELISA, counter immunoelectrophoresis, and mouse neutralization test. One thing I would like to mention it here, it is very important. Why I am talking about MNT or mouse neutralization test? Mouse neutralization test because as we know, alpha, beta, epsilon, iota, and other two toxins, the major toxins. Alpha toxins present each and every type. It contains alpha toxins. It is a chromosomal derived toxins, obviously, and it is present in Clostridium perfringens in all types. Alpha would be available in all types. So, as we have already discussed in the introductory part of this slide, this presentation, that presence of this Clostridium perfringens, it is a normal inhabitants. What in case of intestine? It is a normal inhabitant of the intestine. So alpha would be available everywhere. Alpha would be available, but the quantity is very less. In healthy animals also, if you will take some sample of the intestinal content, alpha toxin would be available. That does not mean the patient was suffering from enterotoxemia. No, not at all. This is the very important bioassay, that is MNT or mouse inhibition test. It is very insignificant for the very little amount of alpha, little amount of alpha toxin. It will not detect the alpha toxin. It will. That's why generally we prefer to make the healthy unhealthy, to healthy unhealthy flock. That it is very useful bioassay technique. Then enzyme linked immunosorbent assay. It is very sensitive for detection of serological test. So recently, highly sensitive sandwich immunoassay technique also it has been developed. Some polyclonal capture ELISA is very important, and monoclonal capture ELISA also can be useful to detect these toxins. And polyclonal ELISA was also found to be very useful or very sensitive for detection these particular toxins. Then another few things I would like to add to this diagnostic process, that is latex agglutination test, that is LAT, and it is very potential in field test. Because why it is so sensitive as well as very quick. So sensitive as well as very quick and simple technique. That's why mostly in a field condition, nowadays people are using latex agglutination test. Later on, then we'll switch over to indirect hemagglutination test. Mostly indirect hemagglutination test or indirect hemagglutination inhibition test. We get to get the titer of the vaccines and antibody titer against the particular vaccines. Mostly we use this test. Then encouraging results as mode of the measuring protective antibody, as we have already discussed. Then mass spectroscopy technique also it is used here. And liquid chromatography, mass spectroscopy or LCMS also it can be used to detect this toxin. So what are the primers for detecting Clostridium perfringens toxins? These are the few primers I have mentioned here. CPA that is for 224 and CPB 195, ETX that is 655 base pair, and likewise ETX, our area of interest is ETX, that is epsilon, that is 655. So here few photographs I have kept it for the different toxins genes, or here I have kept it for PCR photographs, gel photographs. Today, here this is the most important and the vital slides as I feel. Treatment, what is the basic treatment we are going to go for it? Because hardly we get any time to treat the animals, because death most of the time it is very sudden. So inhibiting bacterial proliferation are the main target. Bacterial proliferation we should check. How we can check? So it releases the toxins, obviously it absorbs toxins, so we can go for the serotherapy. If it is toxin has already been absorbed, so we have to take care of the serotherapy. Then we have to target 3 to 4 things, that is we have to address the dehydration, acidosis and shock. 3 things we have to take care, that is dehydration, acidosis and shock. Then bacterial proliferation can be inhibited by oral and parenteral antibiotics, as we know. Then what are the important antibiotics? That they are ciprofloxacin, penicillin and ceftriaxone, most effective nowadays, but it is always better if time permits, then we should go for antibiotic sensitive test. Then flow survey release toxins, what are the toxins are available, but it has not been absorbed to the circulations. So we can use some catheters or catharetics. So administration of antitoxins, we call it is the serotherapy. It is very useful and a very good options here to treat the animals all of a sudden. So combined treatment with antisera and antibiotics was found to be very good and found to be very effective. Combined treatment. That's why I made some different colors. So hyperimmune sera and procaine penicillin, then hyperimmune sera, then procaine penicillin alone, then hyperimmune sera. You can combine the hit and trial method, but these are the few things I have got it from few studies, from few literature I have collected these things. So we can use it. Then immunoprophylaxis is also another portion of this treatment, that is administration of enterotoxaemia, Lamb dysentery vaccines. It is very useful. Booster dose is very important, because that particular vaccine, after vaccine, what are the protection? The protection is very short-lived protections most of the time we get. That's why if it is a very short-lived, the protective titer is very short-lived. That's why we have to rely upon the booster. That is important aspect. Then goats should be vaccinated at interval of 3 to 4 months, then 4 to 6 weeks apart, followed by subsequent annual vaccinations. A polyvalent enterotoxemia vaccine seems to be effective in sheep. Polyvalent. In India, polyvalent vaccines till date it is not available, but still we can think about that. The goats incomplete fluids adjuvant vaccine was found to be best. The recommended epsilon toxoid vaccines, it gives very promising protections. So trivalent vaccine against alpha, beta, and epsilon toxins also it is very good, but I don't think it is available in India till date. In India, Clostridium perfringens type D with tetanus toxoid vaccine it is available. Yes, polyvalent vaccine is not available. Conclusion, enterotoxemia is a devastating disease of sheep and goat. Why devastating? Because hardly it gives any time to think about. Immediately there is sudden death. As a doctor also, as a field veterinarian, I can say it is very difficult to get time to survive the animals, to give any treatments. Immediately it will die. That's why it gives a lot of pain. And it breaks the main economic of our poor people or marginal farmers. The characteristics of enterotoxemia in goats differ from sheep. Yeah, in terms of clinical sign as well as lesions, postmortem lesions and histopathological lesions also. Characteristics everywhere there is different. You will get different type of characteristics in terms of clinical sign, lesions as well as histopathological lesions in case of sheep, and there is different type of conditions you will get in case of goat. Clinical sign and postmortem lesion may not be always same, and molecular detection is the only option for us. Molecular detection is the only option. We have discussed several times. HP of brain tissue in case of enterotoxemia type D, that is very pathognomonic. As we have already discussed, that is your Koenig type of conditions, hemorrhages in the brain tissue, edema. Actually, most characteristics is encephalomalacia. Most characteristics is encephalomalacia. This is very, very pathognomonic in case of enterotoxemia type D. What we call it is a pulpy kidney disease. Enterotoxemia incurs huge costs and loss of valuable germplasm. Yes, of course, we have to think about that. Therefore, in this case, what we can do, that is further research and studies are required for understanding its pathology and pathogenesis, molecular biomarkers and vaccination strategy, as well as most importantly, feeding strategy we have to think of. Thanks